All right, I think that's my cue to go ahead and get started. If you can hear me. Welcome everyone, and thank you so much for joining us for our Mental Health Colorado Candidate Forum. I'm Vincent Atchity, President and CEO of Mental Health Colorado. We are proud to serve as your voice for healthier minds across the lifespan for all Coloradans. We're the state's leading advocate in promoting mental wellness, ending shame and discrimination, and ensuring equitable access to mental health and substance use care. As a nonpartisan organization, Mental Health Colorado doesn't endorse candidates, but we are very interested in educating candidates from all parties, and we want all Colorado voters to be confident that anyone they are voting for will be leading us in the right direction when it comes to mental health. The mental health needs of Coloradans are dire. Our state consistently ranks in the bottom third of the nation in terms of the magnitude of our health needs and the difficulties we too often face in accessing quality care. More than half of the Coloradans who need care never get it. We have one of the highest suicide rates in the country. Through our misuse of alcohol and other drugs, we harm ourselves, our families, and each other. And we too often rely on law enforcement to respond to mental health crises, leading to criminalization, injuries, and death. Jails and prisons are our largest mental health facilities. We need elected officials who are going to prioritize healthier minds across the lifespan, and that's why we're here today. Today, we're meeting some candidates for state senate. We received much interest in this forum, and we weren't able to include every candidate. If your candidate isn't here, but you'd like to see your candidate's statement regarding mental health, you can visit mentalhealthcolorado.org. On our homepage is a section for candidate mental health platforms. I'd like to thank the candidates who are here with us today. As a reminder, this is not a debate. We're not pitting rivals for the same office against each other. Instead, it's meant to be a conversation and an opportunity to educate voters about mental health issues in the state and the important role that state senators can play to support mental health. Before we introduce the candidates, I want to let all our viewers know that there will be time for questions at the end of the forum. If you have a question and you're watching on Facebook, you can leave a comment. And if you're joining the webinar by Zoom, you can use the Q&A function at the bottom of your screen. I'm going to start by going around the screen and calling on candidates to introduce themselves. Let's start with Carlos Lopez. If you mind just introducing yourself briefly and where you're running, and just a sentence or two would be great.
Yeah, my name is Carlos Lopez. I'm from Trinidad, Colorado, and I am the Democratic candidate running for State Senate District number 35. Mental health care is a big issue that we have been facing down here in our region because of a lack of facilities, and I'm hoping that we can change that. Thank you.
Carlos, nice to see you. I think we met in Salida a year or so ago during a permanent supportive housing toolkit.
That's right. That's where I learned about all this. Well, it got me started at least. So good to see you again.
Nice to see you. Next, Doug Townsend, would you please introduce yourself?
Good afternoon. My name is Doug Townsend. I'm running for Senate District 31. That is basically central, east, southeast Denver area. This is an area that's very near and dear to my heart. I had a son that was suffering significant mental health issues for literally half of his life. He ultimately passed away in January of this year as a result of a lot of things that evolved over the years. So it's one that I have struggled with as a parent, trying to find help for a child. And it's just an issue that's very near and dear to my heart that I want to sit there and improve for all of the Coloradans who need this type of help.
Thank you so much for joining us. Carl Hanlon.
Sure, thank you. Thanks for inviting me. So I'm Carl Hanlon. I'm running for State Senate District 8, which is kind of the northwest corner of the state. It's Summit Grand Route Moffat, Rio Blanco, and Garfield counties. So we have some significant areas very similar to Carlos that we really have no coverage whatsoever for mental health services. People really struggle. There was a lot of discussion around in the Rangeley area, some of the struggles they've had up there. For me, this is also very personal, both in the schools and much like Doug, I have a son who is in high school right now who suffers from some mental health issues, but for a great school counselor identifying those a couple of years ago, my story would have ended very differently with my son. And so I'm fortunate that we had the resources at the time to both find that help and the resources in the school, but it's an issue that's very close to my heart and one that is really underserved in my district significantly and something that we need to work on. Thank you.
Great. Thank you so much for joining us. Matthew Menza.
Hey, thank you for having me on today. Matthew Menza, running for Colorado State District Senate 17 here. It's the eastern part of Boulder County, basically from Longmont area, Lafayette down to Louisville. And kind of like Doug and some other folks here, I have a personal stake in mental health. I've had two siblings that have died of suicide here in Colorado, and we have a child with Tourette's. And so we know how hard it is to get help and to get people to pay for mental health help and behavioral health help. And it's a real big challenge I take seriously, and it's first and foremost on my campaign website. And I think it's not a party issue, it's a people issue. So I'm glad that we're all talking about that today.
Thanks for joining us.
Thank you.
Randy McCallion.
Hello, everyone. My name is Randy McCallion. I'm running for Colorado State Senate in District 10, which is in Colorado Springs, El Paso County. And I have a background in public health, so there's a few other things I'll say in a little while, but the perspective I want to bring right now is as a mom and someone who's worked in maternal and child health with families and moms and dads and parents and caregivers for quite some time, some with disabilities. I've worked in autism services, early Head Start, and also with families who have new babies, pregnancy and new babies. And my own journey in motherhood was very challenging. And so I have also supported many people who have gone through something similar. And I think we're leaving our families and our children behind, and it's creating a lot of mental health issues in the future. And we can prevent those. So thank you for having me here. I'm glad to be here with you all.
Thanks so much for joining us. Chris Kolker.
Hi, everyone. My name is Chris Kolker. I am the Democrat running for State Senate in District 27. It encompasses all of Centennial, parts of Englewood, Greenwood Village, and a little bit of Aurora and Foxfield. Thank you for having me. Mental health is one of my top two reasons for even running for office. My wife is a middle school counselor in Littleton Public Schools. I personally was diagnosed with depression in 2003 and spent quite a bit of time, working through therapy and finding resources. I actually came down to your office back in 2019 and met with Lauren Snyder back then to discuss mental health issues. So I know there's a lot to be done, and my big concern here is, how much more is being affected by the pandemic. So thank you for having me.
Thanks for joining us. I'm one of your constituents. So. Nice to have the area represented here with us today. So thank you all so much for making time for this today. As a reminder, Mental Health Colorado, our mission is to achieve healthier minds across the lifespan for all Coloradans. And to us, this means providing a strong start for all of Colorado's children, support for families, access to supports and services, wellness and aging, decriminalizing mental health and substance use, and ending shame and discrimination. I've got a whole bunch of questions. We don't have a whole bunch of time. We've got a bunch of people with things to say. So I'm going to do my best to moderate a conversation, and we'll see how it goes. I'll start with a question, a kind of a general question, and then make sure we get around to everybody so that you've all got something to say. If you don't mind, making a relatively brief statement so that we've got time to get through a series of these questions, that would be great. So just to get us started, first off, how do you define mental health, and what does improving mental health across the lifespan for all Coloradans mean to you? And I will pick people. I think, I guess we'll go in reverse order just for variety's sake this time around. So, Chris Kolker, if you don't mind going first, that would be great.
Sure, I can go first. Mental health to me is incorporated into your whole health picture. I mean, it's physical health is incorporated with your mental health, and I know from personal experience, and I know anybody struggling with mental health, that having the ability for physical activity, a healthy body is a healthy mind. And so improving mental health across our lifespan goes to access starting young, looking for universal screening in elementary, middle school, high school. We making sure that we have the right social workers, psychologists available, counselors available, K through 12. Especially here in Arapahoe County, that is a need. We've seen numerous suicides in Arapahoe County amongst our youth. And so having that increase support service is huge. And then also having support for care. We used to have a Arapahoe house here in Arapahoe County. So having support for care when people are looking to get out of services and have that concurrent care with that transition, and making sure that mental health and substance abuse are combined. So to me, mental health is something people work and strive towards, and they don't always think about in their life. We may be more concerned with what we're putting into our body for physical health, but we don't focus enough on what we do for our mental health.
Was I
Great.
next?
Yes, please. That'd be
Okay,
great.
I was
Thank
trying to
you so
remember
much.
reverse order. Something I learned back in grad school when I got my master's degree in public health was the newer definition of health. And I think that's really key here. So health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And our healthcare system and what we understand about health has been set up with a division in that, because when we even began experimenting with health on the human body in a physical nature long ago, we had to separate the soul and the mind and the body from each other for that to be okay, back in days when, you know, religion was really strong and powerful over what we could do. We've never corrected that. So we still have a health system and an idea of what we do in healthcare that's based on a separation of the physical self and the mental or spiritual self, because those are tied together for many, many people. And I think that's key, is that we have to have a new vision for our healthcare system. And I think a big part of that is reminding people that being healthy isn't just the absence of disease or disability or infirmity. It's the complete presence of being well physically and mentally. And I would just like to point out, I'm really happy to see Peg here. We need more women in government, we need more women voices, and we need that representation, because mental health starts much earlier than many of us are talking about. And it's often women who are the ones that are caring for the young children experiencing postpartum depression. And that's where a lot of our mental health stuff is starting from. So I'm glad to see you're here, Peg, and I'm not the only one representing women. Thank you.
Thank you, Randy. Yep, Peg Cage has just joined us. And Peg, what we've done so far is just introduced, candidates have just introduced themselves very briefly. So if you don't mind doing that, and then we'll carry on with this first question. And we'll come back around to you for that too.
Thank you, Vincent. I am Peg Cage. I am running for State Senate District 18, which is the city of Boulder and most of rural Boulder. Matt Menza has the rest of Boulder County, except for a little bit of SD 16 comes into Boulder County, but between the two of us, we've got it covered. I am interested in mental health because Colorado has the highest teen suicide rate in the United States. And I loved what Randy was saying about having separated health into compartments where it's not supposed to be separated. I think that the most important thing that people know is having accepted Jesus Christ as my Savior, I am very, very sure that the whole thing starts with our Creator, and we were created a whole being. And unless we realize that we were created by a loving Creator who has given us everything we need for a healthy and wonderful life, we will be living a divided life. And so I'm interested to see what you guys are doing as far as encouraging people that they have worth, they have value. And I want to see how we can get the state opened up and give people back their worth and their self realization and able to work. So thank you.
Thanks for joining us. So the question, first question, we were just going to go around and give everybody an opportunity to answer, was just that question about what does mental health across the lifespan for all Coloradans look like for you? How do you define mental health? Just as sort of more general statement. Matthew Menza, if you don't mind, you're next.
All right. Hey, thanks. Kind of like what Randy was saying, you know, there's a holistic concept behind health, and mental health is a big key factor. And one of the things that I think is amazingly sad or tragic is that in our healthcare system, we don't closely couple mental health and healthcare together. So one of the big things that I'm really interested in looking at, especially here in Colorado, is, you know, there needs to be a system of healthcare for mental health that works holistically. So folks aren't just coming in and getting a Band-Aid fix and being sent back out the door. They need a comprehensive system that's tightly coupled with the regular healthcare that makes sense. And the biggest issue that we have, I can tell you as a parent, you know, raising 6 children, 5 little ones at home, one's flown the coop, but you know, it's tough to get people to pay for mental health services. And so, you know, big insurance companies don't like to pay. And so it incentivizes folks to get into the business, and then it's hard to find providers. So we need to look at how to solve that here in Colorado. You know, one of those things that we're doing here is looking at the parity law, and trying to make sure that we're enforcing that. And that's working for us in Colorado. And then there's some other things that we can do here as a team to make sure that we're looking at it holistically as a system, and very similar to what Randy was alluding to.
Thank you. Carl, would you go next, please?
Yeah, sure thing. You know, the great thing about being in the middle is that all of these great ideas and great comments and thoughts are already out there on the table, and I have to agree with almost all of them. For me, it's really about creating those opportunities that it is a complete holistic look at what's going on with our health. You know, one of the things for my district that is a huge struggle is simply getting services, whether they are for mental health or physical health, frankly. We're very rural. The cost of healthcare has risen so much, very few providers. It's very hard to be in a lot of these communities and make a living. So for me in this district and moving forward, it's really about how do we get services and make those available. And that includes both in K-12, which is a critical piece. And as I spoke about in my opening, one that was important in my personal life, but knowing how important that is and making sure that we have those opportunities, as well as making sure in these communities, like I said, when you have a place like Rangeley or Meeker or Dinosaur, even Craig, it's a struggle. And so we really have to work on that rural component, and we're seeing a huge rise in suicides right now. You know, we are kind of out here in the rural part of the state at the highest levels anyway, and now they're just skyrocketing with the pandemic. And so getting those services out here as quickly as possible is just hugely important.
Thank you so much. Doug, would you care to share your thoughts about this?
Certainly. So in terms of defining mental health, I think that it's different for every person, but basically it's, whatever state of being an individual needs to be in order to sit there and live a healthy, happy life that is fulfilling to them, so that they can achieve whatever their goals are. And that's different for different people. Some folks that may feel like that they are living under tremendous stress, that it's overpowering to them. That may be a way of life for other people. So I think that there are some differences there. The challenge of the physical versus mental, there's absolutely a linkage there. I've seen it far too close. And I think that one of the things we have to do is help folks cope. Obviously, as Carl just said, there's been a lot of great ideas thrown out and providing additional support in our schools or whatever, but we have to help as people are growing up and they become young adults and they're going through high school and college age. What's the difference between normal emotional swings? We all have bad days. We all feel down at times. Versus when does that transition from just a down feeling to this is a serious problem that you need help with? So we have to educate people on kind of how they can define that line for themselves. How do they manage social media? I think that's one of the greatest evils we've seen in terms of the impact of mental health to our kids in particular. They don't know how to ignore it or turn it off or walk away from it. So I think there's a lot of facets on how we work on mental health throughout a lifetime, certainly more than we're ever going to cover in an hour conversation here today.
Oh, but we're going to make a good start. Thank you so much. Carlos.
Well, thank you very much. And, honestly, there were so many great sentiments that are, just described. And I think we can all pretty much feel that we need to do something. Mr. Hanlon, I'm sure probably you and I can probably relate the most being out in a rural area that there is a big issue with the stigma of asking for help, especially with a lot of our older ranchers. There was recently a little short film put out, and I shared it on Facebook, pertaining to a specific family just east of Trinidad in Honey, Colorado, where everyone thought everything was fine and the dad was great and he's a supporter and loving, but he just kept a lot of things internalized. And later down the road, he committed suicide. And no one really knew exactly the extent of all the weight, the emotional weight that he was carrying with him, because us cowboys have to be tough and we don't show everything. And I think for rural Colorado, that's especially challenging, especially when you don't have facilities and people to talk to, when people are very, they keep their cards close to their chest when it comes to their emotional being because they don't want to seem vulnerable. And we need to make sure that it's okay to be vulnerable. We need to describe to our people that this is a lifetime progression. You may feel differently at one point in your life than you do in another and later, and how we process things, especially with grief, when we lose our significant other or family members through whatever means, especially Mr. Townsend can relate to this. We all process things in a different way, and how we deal with these crises in those moments really helps dictate how we're going to progress mentally throughout the rest of our existence and how we get over these hurdles. I'm very fortunate that I have a degree in psychology, so I try to
Yeah, are we all frozen? Can you
in
hear
their
me?
shoes.
Oh, there you go. You're back. You froze up there for a second.
Oh,
Carlos.
I'm sorry.
That's
So
all right.
I really think we need to be able to put ourselves in other people's shoes. And that's, again, what I was saying. I really enjoyed having my degree in psychology because I was able to just try to empathize with where they're coming from, not judge why they did what they did, but just see what put them in that position to begin with. And again, it comes back to, the holistic comment made by Mr. Mensa. We've got to really start to focus on taking care of people versus just treating symptoms. So I think there's a lot of work to be done, but it is capable as long as we choose to look out for our fellow man. To kind of step on what Ms. Cage said, we have to look out for each other and treat each other as if we have value and worth, because we do. And again, everyone else said it, we start off when they're young and we instill value in our children to make sure that they provide, good civic-minded adult, or they become good civic-minded adults as we get older.
Thank you so much. And that's a great lead into this next question for you. We know that this shame and discrimination associated with mental health and all of that history of not being able to talk about things, this is harmful to us. And yet we also know that all of us have mental health the way we have physical health, and none of us have perfect health, either physical or mental, from one end of life to another. It's subject to variations and vulnerabilities at different times. And yet there's this shame and discrimination. So what sorts of tips and tactics do you have, or thoughts that you may want to share about how do we end that shame around mental health? And, what are the barriers that prevent us from talking about it? And how can we overcome or help overcome those barriers? In terms of how I'm going to ask you to respond, you don't necessarily all have to respond to every question. So I don't want you to feel like you have to say things that have already been said. But of course, I'm going to give everybody an opportunity. And rather than just sort of going back and forth in orders, I will try and mix it up a little bit to keep everybody on their toes and keep it interesting. Carlos, since you already just made remarks about that challenge in talking about mental health, do you have additional thoughts you may want to share about how to overcome those barriers and end the shame and discrimination?
Yes, definitely. I believe that education is the key to anything for us growing further as a society. So I feel that a PSA would be a great marketing tool to get people aware of the fact that there doesn't need to be shame in admitting that you could use some help. A bag of bricks. Once you drop that bag of bricks to the door, you loosen your load, you feel lighter, you feel better. It's a metaphor for how we can start to accomplish a conversation around our Sunday dinner tables with our family and friends to say, hey, it's okay to talk about these things, no matter how scary they may be at that moment. Keeping it pent up is not going to do any favors for anyone, because then that creates anxiety and anger and frustration. And again, you go down the rabbit hole with drug and alcohol abuse. So we really need to make sure that we start with an educational toolkit where we can discuss this openly in a friendly way that people are not going to feel as stigmatized to keep things close to the chest.
Great, thank you. Who else would like to share thoughts about how we overcome the barriers of shame and discrimination? Carl.
Sure. I just wanted to follow up on what Carlos said. I think we experience a lot of the same things because of the rural nature of our districts. But, it was interesting. I was doing an event in Steamboat, and I was talking about the experience with my son, and I had somebody who was there say, we just never hear a politician talk about their experience or their family that way. And it's a simple thing for us to do, but if we start that process and being very open, and I take a lot of cues from my son, who is very open about talking about what he went through, the fact that he's seen a therapist, that just all of those things make him, he is so open about it, it really takes people's defenses down, and they're much more willing to open up. But in these rural areas, I think it's critical to build bridges with community leaders, regardless of party, regardless of kind of viewpoint in the world, but to build those bridges and have them start talking about it. Because until that leadership in our communities, and that leadership isn't necessarily elected, but until that leadership starts talking about it openly in these rural areas, we're going to continue to lose people, just as Carlos was describing. We all have, I think, friends, especially in rural ranching communities and farming communities, that we have lost, that nobody knew what they were struggling with. And until we can make it easier for them by seeing the community talk about it, we're just not going to get there. So it's about connecting to leaders.
Great, thank you. Chris, please.
And just to follow up and reiterate too, what Carlos and Carl said, but in my own personal experience, I ran for office in 2018, and I didn't talk about my own personal mental health struggles until the very end of that campaign, when for some reason I came out at an event and I spoke about what I had gone through, especially from childhood. At the end of that meeting, I had a young man come up in his early 20s and thank me for expressing and saying what I have done, what I've gone through, because it is something that I know. And that campaign that my wife and I talked about is, you know, how will people approach me saying that I've dealt with and lived with and depression, that I have been formally diagnosed, and would people hold that against me like they wouldn't hold me having cancer, for example, against me for running for office. So so my personal story and my goal is to running for office and to say my story so that people know that, hey, we can find a place in our life. We can have these issues. We can deal with struggles, but we can overcome those struggles. And so that's my goal, is to take the stigma out by talking about my own story and being a voice here. So that's definitely a big part of it. And the other part, as Carlos said, is having that school toolkit, you know, which I know you provide also. I know Mental Health Colorado has a school toolkit. Having the counselors in schools talking about, it's funny you're saying this. We have a 4-year-old who's in preschool, and yesterday we got her lesson plan for the week, and it's about dealing with emotions. How do you express emotions? What emotions what do they mean? And at a 4-year-old level. And that's part of that, to me, that mental health, being able to express those emotions and express how you're feeling. So all that comes together and helps us end that stigma.
Great. Thank you. Yeah, the emotional training for little kids is certainly something that I didn't get when I was a little kid. And when my preschoolers came home and they had learned to stop, put their hands on their belly, take a deep breath, name their feeling, that's like amazing mental health training. So good stuff. Randy, I think you had something to say. Yeah.
There we go. I've got 2 mute buttons. Okay. I love the sharing our stories. That I absolutely agree. And what I've seen in my own journey, and I want to point it out right now in case there are any young parents watching, is I think too often we don't talk about how challenging it is to raise children. And I grew up hearing a lot of things about how much of a blessing they are. And as much as they can be, I think we need to be more honest about the challenges, because it feels like we're shutting down the ability for parents to talk about how hard it is, because then it feels like you're failing. Then it feels like, since they don't feel like such a blessing, maybe you're wrong. And I think that makes it really hard for parents and new parents to reach out, is because everyone else sees that baby as such a perfect little thing, and sometimes you don't. And we need to share that. And so I agree so much with sharing our stories, and that's been hard for me. And I know that it's critical, and I want more parents to do it so that we can tell them that that's normal. Kids are really tough, and you're doing it. And on that note, something that I've heard for a while, and I've started trying to change our dialogue, is we need to reach in for people. When you're struggling mentally and you don't know how you're doing, right? And when you're struggling mentally, you don't know if you're right or wrong, and you're not really sure what the world looks like and how other people might be viewing you. It's really hard. I think we all need to start talking as a society, as a healthcare system, about reaching in and helping people. We know every new parent wants that help, even just to tell their story or to hear that their baby's cute and someone helps tells them they're doing a great job. When someone has lost a child, those of us who have had an experience like that need to reach in for the others. And I know that does happen a lot. I'm not saying that doesn't, but that's something I want to see us change. Stop expecting people to reach out that are struggling. As a society, we've got to be reaching in more. Thank you.
Thank you. Do any of the other candidates have thoughts that you'd like to share about lowering those barriers and ending shame and discrimination?
Yeah, sure. I'm just thinking about my son who has Tourette's, and how hard it was for him at school to negotiate the tics and some of the behavioral issues that came along with that. And one day we just said, look, if you just educate everybody and give them a brief, a PowerPoint presentation to the school or to the class. That might change hearts and minds. And he was terrified, but he got up there and did it. And by golly, he got a lot of support. He got a lot of teachers and kids coming out and saying, wow, I struggle with some things too. So I think we've all kind of, said this, but I know Carlos kicked it off by saying we really need to get, you mentioned PSAs, the National Alliance on Mental Health, they do a lot of public services, but we do need to get it down to a lower grassroots organization or level where we get these kids to start out understanding that people struggle, people have challenges, and instead of just demonizing them and running away from them, we actually look at somebody now and say, hey, that person might be struggling with something, so let's give them the benefit of the doubt. And we're starting to see that across, the police force that you talked about, law enforcement, they're starting to figure that out. We just need to get, society as a whole to understand that people struggle, and we need to be able to recognize that. And I think Randy mentioned that too, and then figure out a way to offer them help, reach in, like you said. So I just wanted to share that story about my son, because it changed a lot of hearts and minds, and that's what it's all about, messaging.
Thank you for sharing. Any other remarks on ending the shame and discrimination, tips and tricks for that? Peg?
Trying to unmute. There we go. You gentlemen talked about the rural area and how the stigma is so big in the rural area. And I see that in my district, where we have a little bit of rural, but we also have a lot of city. And our city dwellers are very highly educated and have been through the college, most of them have college degrees. But through all that, they've had to kind of hide what's happening inside, what's happening behind their doors. And I love that what I'm seeing here is a group of people with different political ideologies, but we all seem to be human. And if the people that we want to represent realize that we are human, they are human, it's okay to talk. We can take the proverbial mask off, look in each other's eyes and have a conversation and not feel like anything is going to permanently scar us from that conversation. I think that's an excellent start.
Great, thank you. So I've got more questions, and we're gonna run out of time before we know it. So I'm gonna move on to the next one, and please don't let any thoughts go unshared as your opportunity comes up to speak. Everybody's responses are touching on answers to all of these different questions, so it's not like it's some kind of a linear progression here. It's all right if we go around a little bit. So, one of our perceptions is that these things that you've all mentioned, education, childcare, stable housing, meaningful employment, access to healthcare, these are all essential aspects of family well-being. What can you do, or what do you expect to be able to do as an elected official, or what can we all do to make these kinds of supports and services more accessible in our communities? Please share your thoughts about that. And whoever wants to go first, I will let go first.
I'm going to jump in here.
Very good.
Vincent. Yeah, from my experience, my son in one of his many suicide attempts was walking down 470 at 2 o'clock in the morning. Obviously, the police came and got him. He ended up being arrested. That was right after the Aurora Theater shooting. The prosecutor's office had no tolerance for any mental health type of defense whatsoever. He actually ended up with a felony conviction out of that. When we look at stable housing, when you're a convicted felon, it's virtually impossible to sit there and find housing. His mom and I were fortunate that we could sit there and provide housing for him. So we were able to do that. Every time you fill out job application, you have to check the box. So there are so many of those other ramifications from the mental health that starts rippling through. And I think we have to look at how we break that type of a linkage as well too, and how we provide alternative paths so that we don't start compounding these issues between employment and housing and all of the other things that you're describing in your question. Because if we don't break that linkage, we all know that far too many of the folks with mental health issues end up in the legal system simply because they have mental health issues. And it becomes that snowball, and we have to stop that snowball from going down the hill.
Thank you. Who else would like to?
You talked, Vincent, Matt Menza here. You talked about how do we get access to other communities. I mean, the big picture here is that we need to break the proverbial iceberg first on what's hindering getting more funding and more help. So, you know, there's the Mental Health Parity and Addiction Equality Act. We need to look at violations of that. We know that Colorado switched to the 7 regions switched to big insurance companies over the last couple of years, which has kind of decoupled some of the mental health funding. So we need to go back and circle the wagon in terms of what Colorado's done in the last couple of years here to adversely affect being able to get some of these resources in place. So we have to have the bigger infrastructure. It has to be sound so we can start trickling these programs and funding down to some of these folks that do great work at the nonprofit lower levels that do a lot of outreach to teens and so forth that struggle with grant money and funding every year. So we need to look at the big picture. We need to decouple or fix what's going on there, crack the iceberg, like I said, and then work our way down to try to figure out how we can get you know, access to these other communities. And I think it starts from the top, and we need to work our way down.
Thank you. Carlos.
So one of the thoughts that I have is actually like the financial component as well, to kind of couple on Mr. Mensa here. I feel that we have to look at our JBC, or Joint Budget Committee, and see exactly where we have maybe potential excessive or inefficient spendings going on. Granted, we have a $3 billion deficit right now in this year, but that's not going to be forever. We are going to come back robust again. I'm a firm believer of that after we have dealt with COVID-19, but we still have to be looking down the future and not be myopic considering what we're facing in this moment. So with that, I would like to make sure that we push for cutting the fat, so to speak, when it comes to our budget. And I am a fiscally conservative Democrat, and I definitely know that, being on a small city council here in Trinidad, that you have to make every penny count, and that's no different when we are working with a larger state budget. So I think for people that are in the cities, they may be able to take on another initiative if their communities are willing to do some type of a financial tool. But otherwise, we have to work with what we have, in my opinion, because I don't foresee any new tax initiatives that are going to be voted in by the general population. So we have to make sure that we're able to look at things that are maybe not as efficient as they used to be or impactful, and trim the fat, because that is a tough challenge that we are faced with, as well as determining policy, but also the budget. And I think in that capacity, we can find some monies here and there to help out our communities throughout the state.
Amen, Carlos.
Carl.
Sure. I think we're at a unique moment, and there was a reference to what is going to be a tough budgetary cycle without question right now. A lot of pressures on services, certainly, and I think it's a time when we really have to focus on our priorities, and that, that's a big part of that, I think, is going to have to be on the health and welfare of our citizens and our kids, on K-12 education, and on health issues. And for me, that includes mental health issues. We also have a real opportunity right now, because of the way things are coming together in our state, to really think about the decriminalization of mental health issues, because it's front and center in so many ways. And it's a real opportunity, I think, on a bipartisan level, to make some really good progress on an issue that is really tough and has a ripple effect, as Doug was pointing out, across a number of facets of our communities, that it's so important to start taking a look at those. And I think it's both a, for me, like Carlos, I've been a long time municipal attorney, so everything starts at the local level and works up, not the other way around. And so as we see communities starting to find ways to begin addressing these things, I think one of the things we can do as a state senate, is be highly supportive of our communities and what they're trying to accomplish, however that is. So that for me is keeping that dialogue open and not thinking that all the answers occur in the Capitol, because most of them don't. So keeping our ears open and being really, really connected to our communities is going to be the path forward. Thanks.
Okay, thank you so much. Other thoughts about this particular question? Otherwise, I'm going to shift to some questions that have been coming in from participants in the conversation. Then I've got more too. So let's see. Here's a question from Raina Gonzalez in Manitou Springs, who has concerns about the mental health of the homeless population. What thoughts do you have about how we can get services to those folks, or how to help with this challenging issue about the homeless population? Chris, yeah, I see your hand up. There you go.
Actually, thank you for the question. I was actually speaking to someone earlier this morning about this. The key with any kind of treatment, anyone with mental health issues, is to have a stable place to lay your head. You have to have a stable place to lay your head at night, and know that you have a place to feel safe and comfortable, and you can be fed, and that's where you start. From there, you move on to the treatment, whether it be mental health or substance abuse. Getting people, first of all, off the street, getting them a safe place is the number one source to start with, dealing with mental illness, mental health, and also with substance abuse. So that's where we start, and we find out, is that a state, is it a municipal issue? How do we work together on dealing with that? So that's got to be our first starting point.
Thank you. Carlos.
Okay, well, it's interesting that, Vincent, you brought up that topic of how we first met up in Salida, where we were dealing with the Department of Local Affairs toolkits for their permanent supportive housing initiative, which incorporated 3 factors. You had mental and behavioral health, drug and alcohol abuse, and then personal life skill development. And you took on that Maslow's collaborative of hierarchy, where you made sure, to like Mr. Colker's point, you make sure that someone has a safe roof over their head. And from there, you can build on a harm reduction method. So therefore, the people that have these tendencies to use vices in order to self-medicate are now being able to focus on what their true issues are, which may have been something that arose when they were younger in life that put them on this path, or whether it was a job loss or a death in the family or a tragic event or whatever it was. And again, it came back to that crisis that wasn't dealt with correctly, as I mentioned earlier. And these toolkits, which I was able to learn so much information about how we can help our local communities. It's just, we have to make sure that the communities are willing to buy in. Here in Trinidad, we have an issue regarding homeless individuals, and people were of the ilk that they didn't want to pay for a facility for people just to continue to have a place to live. I have to pay for my own place, why don't they pay for theirs? Well, ultimately, my thoughts was doing nothing is not a solution here in Trinidad. So if we can put people on the right path, then therefore we're going to have less visibility of people being homeless, and then also them not being homeless at all. So I really think we need to change the hearts and minds of people to say, hey, if we do nothing, that is not a solution. And it may not be the solution that you like, but it's a solution that has been shown to work through empirical data. So if you need the Burns School of Professional Social Work, there at DU was a great resource for us to utilize to gain empirical data for our specific needs here in Trinidad. And I would highly implore that you look to Gary Sanderson in order to take advantage of their resources if you can afford them.
Hey, you mind if I jump in there, Vincent?
Please, go right ahead.
So Carlos, I might reach out to you after this to kind of see what you're referencing in terms of empirical data. I'm going to be honest with everybody out there right now. This is the toughest question right now. How do we get the folks that are on the streets that suffer from mental illness or from substance abuse? How do we get them help, the help they need? So I'm really interested in this. I don't have the perfect solution. I agree with Carlos 100%. We've got to do something. And there's a bunch of different ways. But I will tell you, we left Seattle area after I retired from the Navy. I was a naval officer for 20 years. I was a fighter pilot, test pilot, went up to Seattle to work for Boeing. We left. They put $42 million into the homeless situation over the last 8 years, and the homeless situation and the drug issue increased by tenfold. Tenfold, literally. You couldn't go anywhere without a needle or a tent somewhere, and it was too unsafe to raise my 5 children up there. So we left. We came back to Colorado, and I started seeing some of those same policies here. That's why I decided to run. The bottom line is, this is where all of us, whether Democrat or Republican, we need to get together when we all get elected and figure this out, because this is a tough choice. We don't want to blow taxpayer money. We don't want to blow $40 million like Seattle and be a loser, lose the fight and have more people on the streets, more issues like Seattle. We have to be honest about looking at LA and these other big cities and what they're doing, how they're spending money and how they're spending their taxpayer money and seeing zero effective results. So I just throw that out there because I totally agree, Carlos. We got to do something. I want to see that empirical data, but I know that a lot of these cities that are dealing with these massive issues are not making any headway at all. They're going actually backwards. So that's the toughest question right now.
Thank you. Randy.
Yeah, great conversation. I just want to add in some perspective. So I'm really focused on prevention. That's an area that I really want us to talk about more. And so as much as the issues that we have that are really big right now absolutely need some Band-Aids, some solutions to help right now, we also, as we think about those policies, whatever it is we're working towards, we have to go all the way back and work on preventing some of these things from continuing. And drug use, which, you know, in part is very connected to homelessness in a lot of ways, drug use is a symptom of people being in pain, of people not having a purpose, of people not feeling connected. Drug use is to dampen that pain most of the time. And as someone had mentioned before, not criminalizing, you know, that is important. We need to, and that's something actually, Vincent, I think your organization has talked about. That's really important first, because that's a part of that stigma, right? And something being criminalized turns people away from seeking any support for it. I also want us to remember that homelessness is a symptom, that there's something much bigger going on there and much deeper. And when I read things like one of our conservative newspapers down here, the Gazette, did a big interview of a bunch of people around Colorado, a lot in Denver, and found or reported that a lot of people preferred to be living in the homeless community, with the tent community. What does that tell us? People want community. That the way that we are building society or homes or housing, other than not being affordable and taking too much of people's money, and who wants to pay so much of their money just for that housing and not having anything else wonderful in life, right? But we want community. We want people back. That's what I hear moms saying all the time. Where's our village? We don't have support. We don't have those places to go where we have community. We have to find them and build them ourselves. That's what I hear. And I think we need to remember, my last little point that I'll make, in my public education or public health education background, a big component of making change is being with the people who need it to happen. It doesn't come from us at the top deciding what's best. It's going into the communities and the people that are experiencing that and finding out what it is that they need. Why are you living homeless? Is it choice? What level is it not? Because even though someone says they're choosing to live there, that is not completely choice. When you can't afford a place to live, there's no choice there. So I want to bring that perspective, is that if we need to tackle infant mortality and there's too many babies dying, well, then we need to go to the communities who have too many babies dying and asking why. What is happening and what can we do to help you? We don't have the answers up here. They have the answers down there. It's us that has to make the avenue for them.
Great, thank you. Peg.
There was a recent video that I saw that showed the Democrat, and I don't remember who it was, one of the mayors got elected promising to end homelessness. And they collected a lot of money, and homelessness has not been ended. And the programs that sounded so wonderful when they began and had a lot of public support, they raised a lot of money. They took a lot of money from taxpayers that could have been used for other things. And we still have a homeless program problem. So before we start trying to commit ourselves and our constituents to more public programs, I think we need to research what has been done and why we don't have those community efforts like we used to, Randy, and the people who used to open their homes and feed the homeless and things like that. Why is that not happening? When my husband and I started our business, we ran out of money, and we had a neighbor who invited us over to their parents' house. Their parents went to the back end of the grocery store and got all of the bruised fruits and things like that, and we were able to take home what we needed for that week from the garbage that was thrown out the back door. And then after a while of doing that, the regulations changed, and all of the fruit had to be thrown away rather than giving it to homeless people. So there's always a political twist to what's happening, and we need to be very careful about how we pass laws and what we're doing to the community, trying to help the community.
Great. Well, thank you so much. There's so much more to talk about. We're going to be running really short on, we're pretty much coming to the end of our time here. One of the observations that has made me feel optimistic, even amidst the heavy times and the real serious challenges associated with mental health, is how great our state leadership can be. And just this, not across parties, this shared thoughtfulness and commitment to, acknowledging the challenges and to finding solutions. This is great cause for optimism, I think. And I would just want to thank you all for running for office, for your commitment to the community. What folks who are listening in on the call, your prospective voters may not fully realize, but I know, is that nobody's getting rich by being a state senator. This is truly a mission, and people who devote enormous amounts of their time, and that's 24/7 once the legislative session is underway. You are true public servants, and there's not enough understanding and acknowledgement of how important that role is. And thank you all so much for thinking so much about this. I have a few other little things to point out and say to you all, as well as to folks listening. Mental Health Colorado, we have an annual tribute gala to acknowledge Colorado's progress for mental health. That's coming up on October 10th. It's virtual this year, which means that people all over the state could readily participate. It's free to register for the event if you visit our website, mentalhealthcolorado.org. And even if you can't carve out the hour to be with us that evening, it gives you access all week long to the really fantastic silent auction items so that you can get all of your shopping going for gifts and things as we head into the holiday season. That event's one of the key features. You were all mentioning about the importance of being able to speak to your own family experience and your own mental health experiences. One of our keynote speaker for that event is the Honorable Patrick Kennedy, former U.S. representative from Rhode Island, who has been a great champion for mental health. He led the way for the federal parity bill. And he's a fantastic speaker, and is very comfortable speaking openly about his own mental health challenges and the challenges his family has a great deal of lived experience with. So I'd encourage you to register for our event, take a look at our silent auction items, and catch Patrick Kennedy if you can. We have a Brainwave, which is our network of advocates. Please consider that. I wish you all the best of luck and look forward to working with you on mental health issues in time to come. Thanks again for being with us. We're about to be cut off. It's 1 o'clock, but look forward to future conversations.
Thanks, Vincent. Thanks everybody.
Thank you all.